Hello, 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 and welcome to The Light, Lupus, and I, where I am your host, Salathiel Deloach. I am so grateful that we are here today and that you thought it not robbery to join me here for another episode on The Light, Lupus, and I. I invite you to invite your friends to join us here as we begin our episode with none other than Dr. Abby Abisogun. And I am looking forward to our conversation that we are going to have today. I had the luxury of meeting her a few times, but the last time we had the opportunity to engage, I invited her to join me on the podcast. And so here we are. I am going to make a couple of edits to my page, so just bear with me so I can make sure that everyone can join in. But as we get started, I would like to give you a brief introduction of Dr. Abby. She is a wife, a mother, a board certified endocrinologist, and an entrepreneur. She owns and operates her direct specialty care practice, Shoreline Endocrinology in Savannah, Georgia. Dr. Abby was born in Liberia, West Africa, and immigrated to the US with her family at a young age. She grew up in the suburb of Minneapolis, Minnesota, and moved to the East Coast after high school. She completed her pre-med studies at Latoya University in Baltimore, then went on to earn her medical degree at Russburg Robert Wood Johnson Middle School in New Jersey. Dr. Abby completed her internal medicine residency training at Brown University, following a fellowship training at Duke University School of Medicine. Upon completion of her fellowship in endocrinology, diabetes, and metabolism, Dr. Abby entered private practice, where she experienced a rude awakening. She had been taught to practice patient centered medicine, where the patient's needs and desires, health outcome are prioritized. However, in the real world, she found herself practicing insurance centered medicine instead. That meant the insurance companies were dictating what tests she could order, what medicine she could prescribe, and most importantly, how much time she could spend with her patients during their visits. After 5 years of trying to practice patient centered medicine within an insurance company, Dr. Abby decided to take a leap of faith and open her own cash based specialty practice. She removed the insurance company from the doctor patient relationship and has not looked back since. She practices shoreline endocrinology, her practice, Shoreline Endocrinology, is now approaching 3 years in service in the Savannah community. So without further ado, I invite you to join me as we welcome Dr. Abby to the stage. So if you are on with us, I invite you to make a comment to let us know that you are here. I invite you to invite your family and your friends to join us here live on the Light, Lupus, and I here on our Light the Way tour. So, Dr. Abby, I invite you to light the way, my dear. If you would start out by telling us a little bit about your journey in medicine and a little bit more about what led you into this practice.
Sure. Thank you, Salathiel, for having me on. I'm very excited to be able to chat with you today and hopefully share some useful information for your audience. I'm Dr. Abby Abisogun. I am an endocrinologist, which means I specialize in hormone disorders, one of the most common being diabetes. I also treat and diagnose a lot of thyroid disorders. And we'll get into the various endocrine conditions that I treat. As far as my journey in medicine, it sounds cliche, but I was that little girl playing with my little doctor kit, listening to people with my fake stethoscope and trying to figure out, what to give them for medicines and what to wrap around their knee and all that. I thought it was fascinating. I would watch my pediatrician when I would go to the doctor and as a kid, and I just looked up to my pediatrician. I thought, I want to do that one day. I actually initially thought I was going to take care of children when I started my journey,
Okay.
and things evolved, but you know, I I didn't get, too much into it when I shared my bio, but I come from Liberia, and Liberia was devastated by a civil war that lasted for
Mhm.
years. And during that time, and I was there with my family during that time. There were a lot of infectious diseases that people would, sometimes succumb to because infrastructure was destroyed. You didn't have the kind of health care that you need to address certain issues, especially when you are in the midst of a war. And so that left an impression on me because I knew people who became pretty ill, and some of them lost their lives. And so, as a result, I thought, well, maybe when I get older, I can be the kind of doctor that helps people in this situation. And how wonderful would that be? So that's kind of where that decision happened, was early on feeling like compelled to help in that way. And from there, it was just that's where my focus was in school, coming through all the way through to high school and getting into undergrad. I went to Loyola in Baltimore, did pre med studies. I knew that's what I was going to do. My path didn't go exactly as planned initially, but ultimately I knew that's where I was going to land. And as I, came out of med school and started doing my residency training in internal medicine, I just found myself drawn to diabetes care
Yeah.
because it involved so much conversation, dialogue. I like people. I like talking to people. I like learning about people, learning their story, seeing how I can provide solutions for them. And there's a lot of that involved in diabetes care.
Yeah.
So I really enjoyed it. It was fulfilling to me to be able to sit with someone, hear about what their day-to-day life is like living with a condition like diabetes, and then trying to help them navigate that and figure out what are ways that you can manage this and still go on living your life and doing
Right.
well. So that's having exposure as a trainee, working with an endocrinologist and seeing in real time what they actually do day to day, and having the opportunity to talk with their patients. I figured out, well, this is really what I
Yeah.
enjoy, and this is what I'm going to do. I think I love teaching people, and it just gave me that opportunity to teach. And each and every day, I learn myself from my patients. So as I'm teaching, I'm learning, and I love learning. And so it was a win-win for me to go into that area of medicine, and I haven't regretted it.
Right. Hey, Dr. Miss Bernice, thank you for joining us. And Dr. Abby, your amazing story, as I was reading your bio and just to hear you further talk about your story, to know that you lived through, that space. And so you have the opportunity to remember how things were where you are from, and then to be here in the States to see the difficulties that exist here in the state as
Mhm.
well. So tell us a little bit about what you have noticed or seen to be the difference.
So, one of the major differences, when it comes to the healthcare system in this country versus a country like Liberia, is, first of all, here, if you need care,
Mhm.
you present to any emergency room. regardless of whether you have insurance, don't have insurance, have funds to pay, whatever, by law, you have to be treated. You
Hmm.
have to receive care. And I think that's something that people might take for granted
Yes. Yes.
because
Very
it's not
true.
a guarantee everywhere else. For example, if you are in Liberia and you fall, ill, and or you have an injury or something like that, you present to the hospital. If you don't present cash to pay for the things that need to happen at that time, you're not getting treated. If you
Right.
need an IV bag, you need fluids, you have to pay for it, for them to take
Wow.
that bag from the pharmacy and hang it, for that nurse to give you your IV. So I think we have to keep in mind that, you know, access, there are different levels.
Hmm.
There are
Yeah.
different levels to it. Um, so at least, regardless of the cost, you are able to access care
Right.
here. Speaking of cost, that's another difference.
Hmm.
Some things that, like medicine, supplies, things like that, honestly, if you were to compare here versus other countries, you might find huge differences in cost.
Yeah.
Our healthcare system in this country, there's tremendous spending. The costs are bloated.
Mm.
And so if you compare the same thing here versus, what you might pay in Liberia, it could be kind of shocking, the difference. For instance, here, if you need a medicine, you need to have a prescription written by a physician. If it's a prescription drug, for you to get that treatment, you get the prescription, you go to the pharmacy, you fill your prescription.
Hmm.
Um, in Liberia, typically you can walk into a pharmacy and get, whatever medication
Without a
you
prescription.
need without a prescription. You just need to be able to pay for it. You're going to buy
Correct.
it. You're going to buy the medicine. And so, but typically people are going and paying for their medicine after getting a recommendation from,
Hmm.
a doctor. But even if they don't, like if they feel, oh, I might need antibiotics, for instance, I think I have an infection of a wound or something,
Hmm.
they could just go and buy those antibiotics. So there are some differences, and there are drawbacks to that as well. It's easier for you to go and just pick something up, but also if you think about it, you're not having the opportunity to really learn about, okay, am I dosing the medication correctly for
Right.
the issue
Right.
that I have right now?
Yeah.
What are the potential side effects?
Yeah.
Are there effects that could be harmful? Could it
Yeah.
cause toxicity to my liver? Could
Yeah.
I potentially have a reaction that was severe enough to land me in the hospital? Like, not having that conversation before
Exactly.
introducing that drug into your body, there is a risk there. So most of the time you're
Definitely.
probably okay, but every now and then you're not. And so there's we take that for granted too, having the opportunity to have that
Ask
conversation
those
about,
questions. Yeah.
yeah, ask the questions like, okay, what can I expect when I start taking this medicine? What
Hmm.
are the side effects? Da 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 da. Like, and that's something that's kind of routine practice here in this country. At least that's what I do with my
I
patients.
was just about to, I was
I
literally
can't
just
speak for
about to say,
everybody.
exact. That's a real moment because it's so often as patients, we don't ask those questions about what are the side effects. We wait. Sometimes
True.
we go ahead and purchase that medication and we wait to read the side effects on the side of the bag that we
Yeah.
receive from the pharmacist, or
Right.
even that space. Like we can literally, while we're sitting, in that doctor's office, take the time to Google what that medication is and ask questions right there. And a
Right.
lot of times as patients, we just don't do that. We go based on, the doctor said, go and pick up the prescription, but
Yeah.
we don't take the time, or we don't take the opportunity, or we take the opportunity, even like you said, we take the opportunity for granted to be able to ask the physician,
Yeah.
what are some of the side effects that, are there? Because even in the moment of when we're reading the things on the side of the bag, the doctor may be able to give us information from something that another patient has experienced that's not listed on the side of that bag.
True.
Yeah,
Absolutely.
yeah,
Absolutely. So the
yeah.
opportunity to have that conversation is is actually an advantage that we need to remember.
Yeah.
And so take that advantage and use it.
Yeah.
Because I
Note to patients, take the advantage.
yes, because I see people who, they can't tell me why they're taking what they're taking. Like, oh, I
Right.
just take everything on that list, and it's like, well, you should know why you're taking it
Hmm.
and what it's doing to your body.
Right. Right. Or
So,
not doing.
or
Yeah.
not doing.
Yeah, because a
Excellent.
lot of times we're just prescribed a list of medications that we need to go and pick up, and
Yeah,
you don't know what that medication is specifically for, what's problem it's supposed to be trying to solve. And if you don't
exactly.
know that information, you're just taking medication without the space of being having something to look forward to. Like,
Yes,
I'm taking this because it's going to resolve this. And if it's
yes,
not resolving that, then it's a moment to be able to go back to the doctor and say, hey, you gave me this so that it would take care of this. And this is getting worse. So what is this medication doing?
exactly,
What's the
exactly.
purpose? Seriously. Yeah.
Be proactive. That opportunity to just be proactive and actually have some say in what's going on with your treatment.
Yeah, yeah, yeah. And you talked about the space of wanting to jump into this or launch into this field because of your passion as it relates to diabetes. So for our listeners, while we know that diabetes is prevalent and rampant, I don't want to lose the opportunity for you to educate us on
Mhm.
what diabetes is exactly.
Yes. So diabetes comes in different forms. The two main forms in this country, type 2 and type 1. And type 2 is the more abundant form of diabetes in this country. There's about 95% of people in this country who have diabetes have that type. Sometimes there's confusion about what's the difference between the two.
Mhm.
Think of diabetes as an insulin problem. Insulin is a hormone, and hormones are chemical messengers in our bodies that basically allow different tissues and organs to communicate and certain functions to happen, whether it's temperature regulation or um, the ability to become pregnant, or just all these different things are under the control of hormones. And so insulin is one of these hormones, and its job is to direct your body on what to do with sugar,
Okay.
glucose, which is a fuel source. It's something that allows us to move, to make heat, to for our organs to work, for our muscles to contract. And if it's present, it needs to have somewhere to go, and it has to be metabolized, and it has to be processed. It doesn't just flow into your gut, into your bloodstream, and then magically you have energy. There are steps that have to take place for it to be turned into energy, and insulin is serves an important role in that process. It serves as basically a signal or a messenger of this glucose is here, it's available for energy production. Let's allow it to enter the cell and then be turned into heat or energy. So it serves as a key, like if you had a key to open a door. So the doorway is the transporter protein that allows glucose to flow into the cell. For that doorway to open, insulin has to be present, and it has to be effective. It has to fit in that keyhole and unlock the passageway for sugar to come into the cell and be metabolized. When there's a problem with that key, the insulin, that means either it is not fitting right into the lock, it's not unlocking, it's not effective, there's a defect with the insulin molecule. And that is what type 2 diabetes is. Your body is producing the insulin, but the insulin is not working. Your cells are resistant or not responding to the signal that the insulin is supposed to deliver. And therefore, you're not able to utilize the sugar that you're ingesting. You're taking in the sugar, you're, in the, and not necessarily sugar in the simple form of sugar, but
Mhm.
carbohydrate that then
Yeah.
gets digested and turned into sugar and enters your bloodstream. You're not able to use it because that insulin is not working properly. So it's present, but it's not working. The other issue that can occur with insulin is that it may not be present at all. Your
Mhm.
body is no longer producing it. And typically, that is a result of destruction of the cells that produce insulin. And those cells rest in your pancreas. They're called beta cells.
Mhm.
People can develop autoimmune destruction of beta cells. And that is what type 1 diabetes is. It's your immune system attacking the cells that make insulin, rendering them basically unable to function anymore. And basically they die over time. And then the level of insulin in your blood is declining. If we were to check, we would find lower and lower, and then eventually
Mhm.
undetectable levels of insulin. With insulin no longer present, the body cannot utilize sugar. And so the really the only way to treat type 1 diabetes is to give insulin. And so from the onset of the condition, once it's diagnosed, that individual needs to start taking insulin.
Mhm.
Whereas with type 2 diabetes, their body is still producing insulin and, in fact, might be producing higher than normal levels of insulin to overcome the issue of lack of response to the
Right.
insulin.
Right.
And so we can use different medications and lifestyle changes and weight reduction and diet changes to manage the problem before maybe insulin is ever needed. And some people never end up needing insulin.
Mhm.
So those are the major differences between type 1 and type 2, and basically what diabetes is.
You have such a beautiful mind. Let me first and foremost say that. I
Thank
love the
you.
way I love the way that you provide descriptives for people that they can relate to. Like I never would have thought to put the space of the key as
Yeah.
we're talking about insulin and diabetes. But as you as you were speaking, like you gave me something that I'm familiar with.
Yeah.
We all deal with keys on a day-to-day basis to get into our houses, if nothing
That's
else.
right.
You know,
It's
you
important.
and you you use something that's so powerful. Like I said, you have to have a key. Typically, you have to have a key to get into your home,
That's
and
right.
our bodies are our home, right? And
Yes.
so that space that you were providing, the descriptive of the key and the way that it had to fit, you know, to
Yep.
help someone who doesn't quite understand what's really happening as
Yep.
it relates to diabetes and insulin and things of that nature, but to have that relational piece. So
Yep.
I wanted to acknowledge, that first and foremost, the way
Thank
that you took the time to break it down. And I can see, as I read your bio, I could visually see how a patient could be sitting in front of you and
Mhm.
you helping them to understand what it is that they're dealing with and helping them to gain a better understanding, if you will, about what they're actually dealing with. And
Yeah.
another piece, I love the space that as you were talking and you said sugar, but you acknowledged that you weren't necessarily just talking about tangible
That's right.
sugar that we eat, I mean, that we cook with, or, that we
That's
put
right.
into our Kool-Aid, to
Yes.
make sure they to make sure that they understood that it was
That's
a
right.
greater moment than just that type of sugar. So
Yes.
I
Yes.
want to acknowledge that and tell you that I personally appreciate you taking the time to provide that descriptive, because I know quite a few people that deal with diabetes,
Mhm.
or have, that space of their insulin rising or falling. And
Mm.
so you slightly began to talk about it. What are some of the things that people can do to assist them with, lowering their blood sugar?
That's a
I'll
great
start
question.
with lowering. I guess we can
Yeah,
do both, lowering and raising, because both in some situations are needed.
that's right. That's right. And I'm going to mostly focus on type 2 because like I said, that's the most prevalent form
Mhm,
of diabetes. And so most of your listeners who may be dealing with diabetes or family members of theirs likely will have type 2 because it's just
mhm,
a more common form, just to kind of keep things simple. So in that regard, one of the most important ways you can help keep your sugars lower and under control is to move. Is
mhm,
to move. Movement forces the body to utilize that glucose, that sugar more efficiently and more quickly. So
mhm,
it's not just sitting in the bloodstream creating damage to the lining of the blood vessels. So walking has been shown, just walking has been shown to be so impactful in diabetes management.
mhm,
Just getting outside or getting on a treadmill if you have one, or access to a gym or a track, just getting out and walking for 30 minutes can do wonders for your blood sugars. And not just during the act of walking, but after the hours that come after, you will
mhm,
notice better glucose control, more stable blood sugar levels after you've walked. And if you do that on a regular basis, where you're going multiple times a week,
mhm,
ideally 5 days a week, every day if you can, you then will see that even the days where you're not walking, where you skip your walk, your sugar levels will be lower than when you were doing nothing, where maybe you were just kind of between work in the house,
mhm.
sitting most of the time. So, one of the main things I want to leave people with is you have diabetes, get out there and walk. You don't have to run, you don't have to be in a marathon.
Right.
It doesn't.
I was just about to ask that question
Yeah.
because I have viewers of all ages, and
Mhm.
so I don't want someone to leave this video after watching it thinking, well, she said I gotta go walk. Let me go out here and do this, try to figure out how to do this brisk walk. And that's not you. That's not the space or
It doesn't
something
have
that
to
you
be.
can physically do. So I was really gonna ask you to kind of what form of walking, or is there a type of speed that you recommend? Any of
Yes.
those moments? Yeah.
So, what I tell my patients is start low, like start slow and grow. Like start low and then grow. So, one, thinking about, have you been doing any activity at all? If you haven't, if you are starting from scratch where it's like, no, I've not been active for a long
Mhm,
time, for years, right? I've had a sedentary lifestyle, which means no dedicated time for exercise. And the
mhm,
time that you're walking around the house, because I get this a lot from people like, oh,
mm,
well, I'm pretty active, I'm cleaning the house and I'm
mhm,
going, I'm doing some work in the yard. And,
yeah,
yes, movement is involved, but of course, it depends on how much movement you're talking about. How many minutes did you spend? Did your heart rate actually get up? Did you
right, yeah,
speed up your heart rate?
yeah,
Was more blood, pumping, needing
yeah,
to flow to those muscles to provide nutrients and oxygen? Were you pushing your body a little bit?
yeah, something
Um,
greater than to the refrigerator and back to your
that's
chair.
it. So be honest with yourself. And it's
Yeah,
like, okay, if you haven't been doing anything, that's okay. It's
right,
better late than never. Okay. Um, and so when you start from there, what I advise is just start with 10 minutes. I usually tell people start with 10 minutes.
mhm,
I remember one of my patients from years ago, she had mobility issues and various health conditions that made it difficult for her to walk long
mhm,
distances.
right,
And so she basically had it in her mind that she just couldn't walk. It wasn't possible. And I said, well, how far is your mailbox from the house?
mhm,
And she said, maybe a quarter mile. Like it's, because my house sits pretty far back. I have some land
Yeah.
and my mailbox, I have to walk a little ways. The driveway's kind of long. I said, oh, that's perfect.
Yeah.
So what if you walk to the mailbox and back to the house twice instead of going one time? What if you did it twice? How many minutes might you take? And she said, well, maybe that would take me like 10 minutes because
Hmm.
I can't move that quickly.
Right.
And I said, that's okay. Just look at the time and see how many minutes you spent moving.
Yeah.
Um, and she started doing that, and she told me that day, she was like, I mean, what's that gonna do? It's not gonna make a difference. Um, but the next time I saw her after she actually had started doing that,
Right.
she was like, you were right. I'm looking at my blood sugars and
Yeah.
I actually see a difference. And I didn't think I was doing that much, but it was more than what I had been doing.
Right.
And that's the
Right.
so start small. Like I tell people all the time, you don't need to say, oh, I can't exercise unless I'm going outside for an hour, jogging, running,
Yeah.
or I have to go into a gym. You don't have to be at the gym because I know for
Mm-mm.
some people that gym membership is a barrier. They
Exactly.
may not be able
Exactly.
to afford to pay for a gym membership. The
Very
good news
true.
is you don't have to, right? If you can't go to the gym, you don't have a YMCA, you can't afford that, that's fine. If you've got the ability to go outside and move, perfect. I've had patients who, and this is a concern for some people, are not feeling safe in the neighborhood that they might live in to
Okay.
be able to go and walk. And
Yeah.
that's
It's a reality.
it's a reality.
Hmm.
So I've had that conversation like, okay, I totally get that. By the time you come home from work, it's kind of getting dark and you
Yes.
have to think about your safety.
True.
So we figure out what can we do inside of the
Inside the
home.
home. Yeah.
Yeah, what can we do inside of the home to still get exercise but stay safe?
Yeah.
So that's another thing. I have a patient who, because of knee problems, and she's
Yes.
not the only one. I've had multiple people with the issue, but because of her knees, she couldn't really stand and like walk for a period of time
Hmm.
because the impact on her joints. And so her concern was, I want to exercise, but I don't think I can physically do what I need to
Okay.
do.
Yeah. Hmm.
And I said, you could do seated exercises. And I went on YouTube on my phone and I
Yeah.
pulled up a channel with a trainer who does nothing but seated exercises on his videos. And they're
Gotcha.
great exercises and they're quick 10-minute, 15-minute. I showed it to her. She said, oh, I feel I can do that. I feel like I could do that. And, and she just lit up because she
Yeah.
felt, okay, there's some hope. I can do
Yeah.
something
Exactly. Exactly.
without worrying about being in pain or, paying for it um,
Exactly. And I
after.
want to pause you just for 1 second because you
Mhm.
said seated exercise. And again, we're here to literally light the way, right? And so
That's
I
right.
want to make sure that if someone was to go on YouTube, would
Yes,
they be looking for the words seated exercise
that's
or would
correct.
they be looking for chair exercise? Like, are they one and the
They
same?
can do they can type in either. You could
Okay.
say seated exercises or chair exercises. That's correct.
Okay.
And you'll see various options pop up. Mhm.
Absolutely. We want to make sure if this is something, if you find yourself in this space where you can't go outside, we want to make sure that as a result of you watching this video, this podcast, that you have resources after you leave this podcast to be able to do what it is that you need to do to help yourself be as healthy as possible and understanding that it does not have to be you going outside. If you can't go outside, Dr. Abby has just provided you with something that you can do right inside your own home.
That's right. And of
Yeah.
course, speak with your doctor. If you
Yes.
have limitations, if you have joint issues or other issues that could come in the way, you've had heart problems, have a conversation with your doctor about what is safe for me to do.
Hmm.
Is it
Yeah.
okay if I do this or that for exercise? And then just get their go ahead before you get started on anything, just so you're safe.
In
Um,
true doctor form.
Yes, I want to share a story about one of my patients from when I was actually a resident, when I was
Yeah.
trained in Providence, Rhode Island. I was at Brown University at that time, and what was so amazing about Providence was it was such a diverse community, so many immigrant communities all blended in one place. And this woman was Portuguese; she spoke Portuguese only, and I took care of her for all 3 years I was in residency.
Wow.
But she was usually not the person talking to me. It was her husband because he spoke
Okay.
English, and so he would come with her. He was her caregiver, and so a lot of time was spent talking to him.
Hmm.
Um, and I remember this woman, one of her main concerns was she was wheelchair chair bound because she had over the years gained a significant amount of weight in her joints, her knees, her
Hmm.
back. She was in pain all the time, and she couldn't ambulate. She couldn't walk without assistance. So typically she came, her husband was, pushing her wheelchair to bring her to the office and things like that. And honestly, she was depressed, and
Yeah.
I could see that every time I saw her. It was like she had given up hope. Like this is going to be the rest of my life. I'm just going to be limited and unable to enjoy what I want to enjoy. And so a pivotal moment in her care was when I said to her, I asked exactly, how do you move around your home? How do you
Mhm.
get around the house? I know you're in a wheelchair outside when you come out to your appointments and things, but what do you do at home? And she said, honestly, I'm on the couch
Mhm.
because, between the bed and the couch, because I just can't, I'm in too much pain to do much more than that, and I'm
Yeah.
afraid of falling, and that's real, and I
Right.
understood that. And so I said, you know what, we're going to get you to a physical therapist,
Yeah.
because if you can do some physical therapy, and even if it's sitting down on the couch, if you can do some physical therapy, that's movement. And that might actually help you get some of this pain
Yeah.
more manageable by
Mhm.
just being able to stretch and just be, move a little bit more. And when I tell you, this woman, the first time I ever saw her smile was when she came back after she started
Yeah.
working with physical therapy. She actually was smiling and she could not stop telling me, thank you for referring her, because finally she felt like she had some dignity back. Like she didn't have
Yeah.
to
I
rely
get it.
so much on her husband to do
Yeah.
everything. Like she couldn't even put her own shoes on at some point.
Yeah.
And
Yeah.
for her to be able to just feel like there's hope. Like I can do some things, I can move, I can actually work on it and build up some strength
Yeah.
to be able to do more. She was just so happy. And she started losing weight, and she
Yeah.
she didn't think that was possible. She
Yeah.
just thought, this is it for me. It didn't
Yeah.
take that much movement. And she started seeing some weight come off and being able to get up and walk a little bit around the house.
Right.
That changed her life. And
Eh,
that's why I do what I do, because it's just so fulfilling to
yeah. And
have
I can
somebody
relate.
come back and say that. Man, that
Exactly.
life. Yeah.
I, I definitely can relate personally to your story that you shared as you used the word, like she sat on a chair, she went straight from the bed to the chair. There was a
Mhm.
season of my life where I didn't have the functionality of my body. And so
Wow.
I literally was that person. I was carried from
Yes.
the bed to the chair,
Yes. Mhm.
but one of the things that I'm grateful for and that I was very fortunate to have in my life was my dad and my mom and my dad. But
Mhm.
my dad has always worked in athletics, so I didn't need to go to the physical therapist. My dad was my personal physical
That's
therapist.
it. Yeah. It's a
I'm sitting
blessing.
on the couch. Yeah, I'm sitting on the couch, and he's doing all of the arm lifts, like
Yes.
literally grabbing my arm and lifting them and moving my legs to make sure, that my legs understand that they were created to move. My hands, my
Yes.
arms, they understood you were created to move.
That's
And
it.
we're going to get you back in a space that you are in movement. And
That's right.
with time and over time, I was able to gain the functionality of my body, but that space of being stuck on a chair and feeling like you're losing your identity, and to
Yes.
come from that space. and back into society and being able to, I don't need the chair anymore, to be able to
Mhm.
take, I can just think back to being able to take those first steps again. And,
Mm.
that feeling of, okay,
Yes.
I'm coming, like I'm on my way back. Like, look out,
That's
here she
right.
come.
Yes.
So hearing that
Empowered.
story, exactly,
Yes.
exactly. To know that, we or people can go from that space of living a full life and
Mhm.
life happening, and you finding
Mhm.
yourself ending up on a couch and then realizing, okay, my life has completely changed now. I
Yes.
have to figure out what my next step is. And for
Yes.
your next steps to be someone helping you to regain all of those
Function.
functionalities back,
Yes.
it's a real life thing that a
Yep.
lot of people, honestly, that people do deal with, but
Yeah.
because of the embarrassment, they deal with it in silence, you know, and they
Yes.
don't have the support system. I was very, very
Yeah.
fortunate to have the parents that I had in my life. But
Mm.
there are people that don't have what I
Don't have
had,
that. Mhm.
and like you said, what do they do when they don't have those resources? Someone to get them from their home to that physical therapist.
That's
And there are
right.
people like you that exist, to be able to help them find those resources, to have those conversations,
That's
and
right.
to also have patients that trust you,
Yes.
because you have to have a patient's trust for them to be willing to take
Absolutely.
your advice, and,
For them to
I,
even be willing to share the
yes,
information, because
yes,
you said something important, embarrassment.
yeah,
There's embarrassment that comes. It's natural, it's human. When you are that vulnerable, when you
hmm
go from, like, being in control, as far as you're concerned, you think you're in control,
yeah,
right?
that was me. I controlled everything.
Yeah, and then suddenly you can't do
Yeah,
basic things like just get up and walk.
yeah.
It is so, um people
I,
feel so embarrassed, so, like,
mhm,
defeated, so,
yeah,
you know, like, so low, like,
yeah,
"Man, I can't believe this is my life." But the
exactly.
but the reality is your life's not over. It's
Mm-mm,
not over. You're st
no,
as long as you still have breath,
that's right.
right? I mean, the human spirit is amazing. If you just have breath and you stay hopeful,
Hmm.
you can get out of that
Yeah,
situation.
yeah,
You
yeah,
just have to tell yourself, this is only a season. Like you said, it's only a
exactly.
season in my life. This is not where my life ends or
Right,
stops.
right.
I will get out of this. What do I need to do? Who do I need to enlist help from? What resources are available to me? Who do I need to talk
Yeah,
to see what I can get as far as assistance so I can get out of this situation and get back
exactly.
to functioning again?
Absolutely, absolutely. And I follow you on social media. And one of your
Thank you.
most listen, your videos are absolutely, if someone would take them, they are absolutely life-changing. Most recent one that I had the luxury of watching was the one where you talked about your her name is Jessica. I remember her name.
Oh, my patient
That's, oh
Jessica,
my gosh. Oh my gosh. Your
powerful.
story where you talked about Jessica, and you begin to talk about the space of encouraging her to celebrate
Yeah,
every single win. And I was like, ooh,
everyone.
like that flashback, the moment of remembering how important it is, no
Yes,
matter how large or small the win is in life. It's so
yes.
important for us to celebrate the wins. And even if
Celebrate.
we don't have anybody else to celebrate with us, right? To know that it's important for you to see the value in what it is that you're doing and
Yes.
to celebrate your own win.
Yes.
Because it's personal. It's great to have other people with you to celebrate,
Mhm.
but it's a personal thing. So even when nobody
Absolutely.
else wants to celebrate, you find the
Celebrate
value. And
yourself.
it was just so encouraging and motivating to hear you tell her story and to encourage her and to know that you didn't have to tell her story.
Yeah.
Like, to find doctors like you it's an absolutely amazing moment. You are a true gem,
Oh, thank
to the
you.
patient population. You are a true
Thank you
gem. And
so
while
much.
I'm not your patient, to be able to open up social media and
Yeah.
to see someone like you, a doctor, that talks from the human aspect.
Yeah.
And you talked about how you reached out to that patient and
Yeah.
you asked her if it was okay, that space
Yeah.
of dignity that you allowed her to maintain, but you
Yeah.
still wanted to be a part of her celebration team. It was just a
Absolutely.
beautiful, beautiful thing. And
Thank
how,
you so much.
yes, yes. Again, I want to make sure that I let people know like who I am talking to.
Yes, you got me over here tearing up. Like, don't do that, Salatio.
Yes, like seriously, in the space of practicing gratitude, because people don't have to help you. People
Yeah.
don't have to help you get to where you want to be to learn to practice gratitude. Like you had me going. You
Yes.
really,
Do it. It's
you really,
available.
really did.
Do
Yeah,
it. It's so empowering. It's so uplifting. It's powerful. It
yeah,
can make you literally take yourself out of the situation you're in now and just transform your life. You have it within you. You don't need anybody else to do it for you. It's within you. When you start celebrating every little win, just even having breath and waking up in the morning, when you start having that gratitude and stop
yeah.
focusing on the negatives and the things you don't have and the things that didn't go well, and you start focusing on the things that you do have and the
Absolutely.
things that you are doing, it shifts your entire mindset. Your frame of mind is different, and you start seeing things happen in your
Yeah,
life that you didn't think were going to happen,
so
but
true.
you can will it. You can will these things
Yeah,
and they can manifest. If
yeah.
it's a decision, you just decide up here to celebrate, to be grateful, and to keep pushing forward.
Yeah, yeah. How important is it? How important do you feel it is for patients or individuals that have been diagnosed with anything to have a team of people around them? And
Oh,
what does that team need to entail, if you will? Because you
yeah.
talked about that space of a team on that live.
It's always a team effort. That's why I tell my patients, like, because I appreciate the gratitude for my care and all the things that I, maybe help them with. But I always say it's a team. Celebrate the part you've done in this.
Hmm.
You took the action that I, the plan that I came up with, and you implemented it into your day-to-day life. I
Yeah.
can't come home with you and be like, "Did you do this? Did you take your medicine?"
Right, right, right,
I'm not
right.
there.
Yeah,
Yeah, I'm
yeah.
not there. Although some of my patients will say, like, "Yeah, I could hear you in my head. Like, I remember when you said this, and so I didn't do it." And.
Yeah.
But so the team starts with both of us, the doctor and the patient,
Hmm.
both of us collaborating and having it as a partnership and not a one-way thing, like where I'm talking to you and I'm just
Right,
giving you orders. And
right.
then there's no, return as
Yeah,
far
that
as
space is important to have that
it's really
conversation, a
important,
two-way conversation. Yeah,
two-way. And
yeah,
then after you step outside of that, there's family. And for me, I value family so much. It's how I was raised. It's
yeah.
just part of who I am. So I am always going to try to connect with my patient's family. Even
Mhm.
if I've never met them, we're going to have conversation during our encounters about
Wow.
their family. So I'll ask, like, who's at home with you? Who do
Yeah,
you live with? Who helps you? Or who can you reach out to help you start this plan? Or if
mhm.
I'm talking to a patient about exercise, I always say it's best to have a buddy. Who's going to be your buddy?
Yeah.
Oh, okay. Yeah, my coworker, we've been talking about it. We, going out to walk at lunch, and okay, let's make it a competition. Who can get the most steps?
All right.
Put some money on it. No, I'm
Yeah,
just
well,
like incentivize.
yeah.
But so the team extends from just the two of us to then family, close friends, and then other physicians who might need to help. I'm the first, if I feel like there's something going on, if it's not related to what I'm doing, if it's not within my scope, I
Mhm.
will tell you right then and there, I think you also need to see XYZ
Right,
specialist.
right.
Is it okay if I put a referral in? If I can facilitate that, I'll do it. It doesn't have to be coming from your primary doctor, I'm part of
True.
your healthcare team now. So if this is something you need, I'm happy to facilitate because I know, offices are busy. The primary doctor may not be able to get you in until a certain date.
True.
And
Yeah.
in the meantime, you're having a hard time. We need to get the ball rolling because once
Exactly.
that referral goes out, then there's also wait time to see that doctor. So we
True.
need to get on it as soon as we
Yeah.
can. So, but enlisting the help of other specialists and then other people on the healthcare team, including I'll put referrals in for home health. I'll put a referral in for a visiting nurse to come out and, check in, do vitals, pull labs if the person is in a situation where they cannot leave their home and there's certain things that we need. If that person can go to them and assist them there in their home where they are, or like do a home assessment and see if the home is safe, like when we're talking about
Yeah.
our senior patients, for
Yeah.
instance.
Yeah.
If they're having falls, I will see if we can get a home health assessment where they can look and see, is the environment safe at home, because sometimes people don't realize that this is a hazard, that's a hazard. We have to
Yeah.
educate them, but if we
Yeah.
don't know exactly what the home situation is, then we can't identify those hazards. I can't tell
True.
you, oh, you should take that rug away because you're more likely to fall, you're more
Yeah.
likely to trip. Um, so it's a whole team of people, and the team, who's on the team really depends on the condition that we're dealing with, the state of that patient,
Right.
sort of where they are as far as their baseline versus where they've come from that baseline.
Hmm.
Sometimes you need more people on the team because there's more care
Yeah.
needed, you
Yeah.
know. So, but it's important to keep that in mind that everything may not come from that one doctor that you're seeing. You may
Hmm.
need multiple people to come together and help you. And don't be afraid to. I just had a conversation with a patient yesterday about not being so worried about burdening people.
Hmm.
I
Yeah.
think
That's a hard one.
it's
That's a
hard.
hard one. Yeah.
I think it's hard. Like, I get on my own parents about this. They don't want
Hmm.
to worry you. They don't,
Hmm.
oh, I didn't want you to worry,
Yeah.
so they don't talk about what's going on, how they're feeling,
Hmm.
and they're dealing with something and they're not saying anything about
Right.
it.
Right.
Right. And they'll even do that with the doctor. They may
True.
sometimes they don't tell that they go to the doctor
Yeah.
appointment and they think they should just say everything's good. Like the
Right.
doctor will be more pleased with me if I say I'm doing everything right, everything's great, I
That's true.
understand everything,
That's
I don't
that
have
is true.
any
That's
issues.
an unfortunate truth. It really
It's
is because
reality.
when we go to the doctors for that space of we want treatment, but if we don't again have that two-way conversation to be able to tell the doctor all of the things that's going on, they can't help us effectively.
Yes, that's right. And so I
Yeah.
always celebrate that when people are very honest with me and say, "Ah, you know, I'm just gonna tell you, I haven't been doing this."
Yeah.
And then
Yeah.
I'm like, "Thank you so much." That gives me an opportunity to
To
actually
know why
have,
these numbers not looking like they're supposed to.
yeah, so we can actually get to the bottom of the
Yeah.
issue. Okay, so you haven't been doing it. Let's talk about why. Is
Yeah.
it schedule? Is it cost? Is it, discomfort, pain? Because there's always a reason.
Hmm.
Is it
It is.
depression? Is it
Yeah.
depression? Are you depressed
Yeah.
where you can't even participate in your own care?
Yeah.
Because that's a real issue. And so when we actually are transparent, then we can actually get to a solution. So I
Yes.
tell people
Yes.
all the time, thank you for telling me. Thank you for being honest. Thank you,
Yeah.
and they're like,
Safe space.
well,
You create
I
a
know
safe
you
space.
might get on me. I'm like, it's a safe space. This is where you can be
Yeah.
vulnerable. If not here, then where? Right?
Yeah.
Like, I'm here to help you. I'm not here to be like, you know,
Exactly.
you didn't do,
Yeah.
and some people expect that.
It's
They
true. It is
"Oh,
true.
you go ahead and get on me." I'm like,
Yeah.
"No,
Yeah.
why?"
It's
For
a part
being
of
a
life.
human being,
Right. Yeah.
right?
Yeah. Yeah.
So,
Yeah.
you know.
And as an endocrinologist,
Uh-huh.
tell me what are some of the things, because we mostly have talked about diabetes. So
Yes.
what are some of the other things that you deal with?
Okay, so I'll try to put out terms that people are most familiar with. So
Okay.
mentioned diabetes. Thyroid disease is the next most common. And so that could include underactive thyroid, overactive thyroid.
Mm-hmm.
So people have heard of conditions like Hashimoto's thyroiditis or Graves' disease.
Yeah.
Those are both autoimmune conditions affecting the thyroid, which is right here at the base of the neck.
Right.
People can have nodules like growths in their thyroid.
Mm-hmm.
People hear the word goiter, that could be something that triggers like, oh, my grandmother had one, or goiter simply means an enlarged thyroid gland, and it could be enlarged as a whole, or it could have little growths within it. And sometimes, thankfully not most of the time, but sometimes those growths can be cancerous. So thyroid
Mm-hmm.
cancer is another thing that I diagnose and treat. um, Outside of those two big conditions, the others that I treat include obesity. That's actually, I would say that's up there with thyroid disease and diabetes as far as the number of people, I'm taking care of for that purpose. There's a lot of overlap, let's say.
Right.
There's a
Right.
lot of overlap with endocrine conditions and excess weight. And so I
Mm-hmm.
tend to treat those things together all the time. I do osteoporosis and other bone conditions.
Mm-hmm.
I take care of low testosterone states, which affects men.
Mm-hmm.
I take care of women who are going through menopause. Either they are starting to have the change, or they've fully gone through the change and they're really struggling with certain symptoms. I help young women who have what people know as PCOS, or
Mm-hmm.
polycystic
Yeah.
ovary syndrome. That condition has implications when it comes to your fertility and other things, your reproductive health. Um, and so I help with those issues as well. And a lot of other conditions that no one thinks about unless it happens to come up. I just saw a gentleman who he drove from a couple hours away, and the reason he came was because one day he was just cutting his grass and suddenly had a really bad headache, and then he started having nausea, then he started vomiting. Ended up in the emergency room. They did a scan of his head, and they found a tumor in his head. And basically he was at a hospital that was not equipped to do a whole lot about this issue, so they had to fly him over to Savannah to get fully evaluated, because they had to have neurosurgery get involved because of this mass in his head. Well, the mass turned out, after he did an MRI here in Savannah, it turned out to be a pituitary tumor, a pituitary gland tumor. So I treat pituitary issues as well. And that's the gland that controls the rest of your endocrine glands throughout your body, including your thyroid, your adrenal glands, all these other glands. Your pituitary gland is underneath the brain. If you go up your nose, you'll end up there. It is a little tiny gland that hangs from the brain, but it's so important. It controls so much in your body, and we don't think about it unless it's not working properly. From autopsy studies, we believe about 1 in 10 people have a growth in their pituitary gland, and
Oh.
thankfully, it's not a cancerous kind of growth usually, but it can disrupt different functions in the body. It could be reproductive function, it could be thyroid function, it could be adrenal function. Your adrenal glands make adrenaline, or the hormones that allow you to support your blood pressure or keep your blood sugar up, the things that you need to live. And so there are a lot of conditions. One of the reasons I went into endocrinology is because it's a specialty that touches the entire body, the whole
Yeah.
person.
Yeah.
for me, the joy I get out of practicing medicine is dealing with the whole person.
Yeah.
So, though I wanted to be specialized and have expertise in an area of medicine, I still wanted to feel like I was looking at the whole person,
Right. And
not
it's
focusing on just one part, you know?
right, right. And it's so important,
Mhm,
to when you go in for care to
mhm,
have someone that's going to focus on the whole person, not just
mhm.
the symptom that you're dealing with. Because
Right.
I could be dealing with the symptom because I have XYZ going on in my life.
Yeah.
And that might have literally just triggered,
Yeah.
what it is that I'm dealing with. And a lot of times when people go into their physicians, the personal stuff doesn't come up.
It's true.
It's just the thing that you came into the office that you're
Yeah.
dealing with that comes
Yeah.
up. So yeah,
'Cause there might it's just often there's just not the space to
hmm,
allow that
absolutely.
release
That
to
time and the
share.
space. Yeah, yeah,
Yeah.
yeah. And so, actually, I want to ask one last question because I do know that people deal with the thyroids. So, can you share some early signs that people should look for when it
Yeah.
comes to thyroids?
Yeah, sure. So thyroid disease, the interesting thing is, sometimes it can go undiagnosed for a while
Mhm.
because the symptoms can be kind of vague. They
Okay.
look like anything else wrong. One of the prevalent symptoms is fatigue. And I mean, you could be tired for a
Yeah.
number of reasons,
Yes.
right? So often people might attribute that fatigue to, well, I've just been working a lot, or, well, I wake up at night, here and there to use the bathroom, and then it's hard for me to go back to sleep. So, and yeah, those are reasons you could be tired, but
Yeah.
usually the fatigue where we should get concerned is you're getting good sleep, you're not overworking yourself, and you're there's no particular reason for you to be
Okay.
so tired all the time. You might have a day out of the week where you're really worn out, you've been doing a lot, but then you get some rest and then you get back to yourself.
Right.
But if it's an ongoing thing where you're dragging, it takes so much out of you just to do your day to day, you need to get things looked at. And one of the tests that should be run is what's called a TSH, or thyroid stimulating hormone level. It's just a blood test that often, you'll find it's maybe included in your physical labs, but it depends on the doctor how often they might check it.
Hmm.
If you have, unexplained fatigue that's just ongoing, it should be one of those tests that's included
Yeah.
in your blood work. Um, Another, especially for women, is their menstrual cycle might be abnormal, like it might be irregular.
Hmm.
That could be one of the manifestations that there's a thyroid issue, is that cycle is not happening the way it normally, would. Some of the other symptoms can include hair loss that's not normal, like not explained. There's normal shedding, and then
Hmm.
I'm losing a lot of hair,
Yeah.
and I don't understand why. And so that needs to be one of the things that's checked if that's happening and it's an ongoing issue. Um, Skin being really dry, bowel movements being real slow, or
Hmm.
opposite, going a lot more than normal. That's not my
Right.
usual. What's going on there? Temperature regulation is off. Everybody else is comfortable, but you're freezing in the same
Mm.
room. Why? That's not
Yeah.
normal.
Yeah.
Everybody else is comfortable, but you're sweating hot all the time. What's going on there? Those are some of the signs that you could have dysfunction in your thyroid gland, and it can be
Awesome.
checked with just a blood test.
Awesome. Awesome. Thank you so much for taking the time to explain that. And any final words that you would like to share with our audience?
I would say, first of all, thank you so much for listening, watching, however you're getting this content. um, my final word is, it's your body, it's your health. Be empowered, be be very much active in what's happening with your health. Ask questions. Don't feel like you're bothering the doctor or you're bothering whoever is helping you on your care team. Don't, it's about how you ask, of course, um, and you want to be respectful of people's time, absolutely, but you want to be your number one advocate. So, don't take a passive approach to your health. Be proactive. Learn what your family history is as much as you're able to. Ask questions. What conditions are your parents, your grandparents, and your siblings dealing with? Because those could have implications for you. You might be at higher risk of certain things because of the fact that there's a family history, like diabetes, for instance. So you want to be aware of that, and you want to bring that up in your visits with your doctor. You want to make sure that they are aware, this runs in my family, that runs in my family, because that informs them on how to do evaluations when they do your physical, your annual or whatever. What tests should we include? What things should we screen for? What recommendations should we make in order to be proactive? Because it's always better to prevent than to treat. If you can get a heads up and know that this is up ahead, if I don't change what I'm doing, and you make that shift and avoid it altogether, that's going to be better in the long run than to just kind of wait for things to happen and pop up. And then next thing you know, you have to take this medicine and do this procedure and that. And then that, quality of life is dependent on that. You want to not only live a long life, but you want to make sure that you're able to enjoy your life. You don't want to be here and then running back and forth to the hospital if you can help it. So that starts now. The sooner you are proactive about your health, the
Yeah.
more you'll be able to enjoy your life. That's
Awesome,
my last
awesome,
word.
awesome, awesome. And those were great last words. We want to take care of ourselves now,
Yep,
so that we can continue to enjoy and live a long, long life. So I
that's right.
thank you again for being here with us today and for not thinking it robbery to come and be a part of the Light Lupus and I, where we're here, we are literally on a tour to light the way. And I
Yeah,
thank you for taking the time and literally like your light today, it shined in a major way, both
thank
from a
you.
professional perspective and for a personal perspective. Like you can tell that you're rooted in something special. And I'm grateful for you
I'm
again taking the
grateful for
time.
you. I'm grateful for what you're doing because
Yes,
this is
ma'am.
this is how you change people's lives.
Yes.
Just sharing information, empowering people. So thank you for what you do so
Yes.
much.
Yes, ma'am. Thank you. Guys, that was an amazing, amazing show. I thank you all for joining me here today as we work with as we spoke with Dr. Abby. It has been a profound day, and I hope that if you did not know much about diabetes and thyroids and how important it is to have that two-way conversation with your physician, that speaking to Dr. Abby today or listening to our conversation today, that it changed your mind in the way that you communicate with your physician. I thank you again for joining us here on the Light Lupus and I, where we are literally on a tour to light the way. And I hope that today your way was lit so that you could see clearer. Have a blessed day.